हेलो फ्रेंड्स, आप सभी का हमारे यूट्यूब चैनल पर स्वागत है। आज का हमारा टॉपिक है नर्सिंग केयर प्लान ऑन हाइपरथायराइडिज्म या ग्रेव्स डिजीज या थायरोटॉक्सिकोसिस। इसके अंदर हम डिफरेंट नर्सिंग प्रोसेस स्टेप का यूज़ करते हुए नर्सिंग केयर प्लान तैयार करने वाले हैं। तो आइए देखते हैं नर्सिंग केयर प्लान ऑन हाइपरथायराइडिज्म। नर्सिंग केयर प्लान ऑन हाइपरथायराइडिज्म में हम जो डायग्नोसिस यूज़ करने वाले हैं उनके नाम यहाँ देखते हैं। Risk for decreased cardiac output, fatigue, risk for imbalance nutrition less than body requirement, एंजाइटी एंड डेफिशिएंट नॉलेज। ये हमारे आज के वीडियो के डायग्नोसिस होंगे नर्सिंग केयर प्लान। नेक्स्ट देखते हैं शॉर्ट इंट्रोडक्शन ऑफ हाइपरथायराइडिज्म। Here hyperthyroidism, also known as Graves' disease, Western disease या thyrotoxicosis, is a metabolic imbalance that results from overproduction of thyroid hormone triiodothyroxine T3 and thyroxine T4. The most common form is Graves' disease, but other forms of hyperthyroidism include toxic adenoma, TSS secreting pituitary tumor, subacute or salient thyroiditis, and some of the form of thyroid cancer. Next, defining characteristics of this disease means sign and symptoms of this disease here: unintentional weight loss. Next, rapid heart rate tachycardia. First, unintentional weight loss even when appetite and food intake stay the same or increase here. Second, rapid heartbeat tachycardia, commonly more than 100 beat a minute. Next, irregular heartbeat arrhythmia. Next, pounding of heart, palpitations. Next, increased appetite. Next, nervousness, anxiety and irritability. Next, tremor, usually fine trembling in the hands and fingers. Next, sweating, and next change is the menstrual pattern and increase the sensitivity to heat. Next, changes in bowel pattern, especially more frequent bowel movement. Next, an enlarged thyroid gland goiter, which may appear as a swelling at the back of the neck. Next, fatigue, muscle weakness, difficult speaking, skin thinning, and fine brittle hair. Next, देखते हैं हम hyperthyroidism, a healthy person and a hyperthyroidism person here, bulging eye and goiter in the case here, normal thyroid glands or a enlarged hyperthyroidism gland. नेक्स्ट देखते हैं नर्सिंग केयर प्लान जो हमारा आज का टॉपिक है। फर्स्ट नर्सिंग डायग्नोसिस होगा हमारा यहाँ पर आज। रिस्क फॉर डिक्रीज कार्डियक आउटपुट इन नर्सिंग असेसमेंट। सब्जेक्टिव डाटा देखते हैं सबसे पहले नर्सिंग असेसमेंट, इसके बेस पर हम जो केयर प्लान यहाँ पर तैयार करेंगे। Subjective data: patient says that I feel weakness and easily fatigue and severe thirst. Here, objective data for this: vital sign, CBP, central venous pressure, ECG, electrocardiogram, and sign of dehydration. Here, next, objective data and subjective data for the assessment to writing nursing diagnosis. For this, we use next nursing diagnosis step, risk for decreased cardiac output related to increased cardiac workload secondary to hyperthyroidism. Next, goal for this diagnosis here to maintain adequate cardiac output. Next, nursing intervention and their rationale for this year. Nursing intervention and rationale. तो फर्स्ट नर्सिंग इंटरवेंशन देखते हैं। मॉनिटर बीपी लाइंग, सिटिंग एंड स्टैंडिंग इफ एबल। रेशनल फॉर दिस: general orthostatic hypotension may occur as a result of excessive peripheral vasodilation and decreased circulatory volume. Number second here, monitor central venous pressure if available, provide more direct measure of the circulating volume and cardiac function. Next, number third intervention here, investigate report of chest pain or angina. Here, interventions rational here may reflect increased myocardial oxygen demand or ischemia. Next, number 4 intervention: assess pulse and heart rate while patient is sleeping. Here, provide a more accurate assessment of tachycardia. Next, number 5th assessment here, auscultate heart sound, note extra heart sound, development of gallops and systolic murmur. Here, rational for this: Prominent S1 and murmurs are associated with the forceful cardiac output of hypermetabolic state. Development of S3 may barm of impending cardiac failure. Number 6 intervention. Monitor ECG noting rate and rhythm. Document dysrhythmia. Rational for this. Dysrhythmia often occur and may compromise cardiac output. Next, number 7 intervention here. Auscultative breath sound, not adventitious sound here. Rational for this, early sign of pulmonary congestion reflecting developing cardiac failure. Next, number 8, monitor temperature, provide cool environment, limit bed linen or clothes, administer tepid smudge bath air. Rational for this, air fever may exceed 104 degree Fahrenheit may occur as a result of excessive hormone level. Next, number 9, observe sign and symptoms of severe thirst, dry mucous membrane, weak or thready pulse, poor capillary refill, decrease urinary output and hypotension. Here, rational for this, rapid dehydration can occur which reduce the circulating volume and compromise cardiac output. Next, number 10 intervention, record intake and output and note urine specific gravity, significant fluid loss. This is rational for this. Here, next 11, wait daily, encourage chair rest and bed rest, limit unnecessary activity. Irrational for this, activities increase metabolic and circulating demand. Number 12 intervention here, observe for the adverse side effect of adrenergic antagonist, severe decrease in pulse, BP sign of vascular congestion, heart failure, cardiac arrest. Here rational for this, indicate need for reduction or discontinuation of the therapy. Number 13 intervention here, administer IV fluids as indicated. Here rapid fluid replacement may be necessary to improve circulating volume. Next, number 14, administer medications as indicated. Thyroid hormone antagonist, propyl thyrouracil. Rational for this may be definitive treatment or used to prepare the patient for surgery, but the effect is slow and so may not leave thyroid storm. Next, beta blockers, propranolol and atenolol and nadol. Rational for this, give to control thyroxic effect or tachycardia, tremors and nervous, and is the first drug of choice for an acute storm. Next, strong iodine solution, solution or supersaturated potassium iodide. Potassium iodide may be used as a surgical preparation to decrease the size and vascularity of the gland or to treat thyroidism. Next, radioactive iodine near Na131I and or Na125I following NRC regulations for radiopharmaceuticals. Here, rational for this, radioactive iodine therapy is the treatment of choice for almost all patients with Graves' disease. Number 15 intervention here, provide supplemental O2 as indicated. Here, rational for this may be necessary to support increased metabolic demand or O2 consumption. Here, number 16 intervention, provide a hypothermic blanket as indicated, used to lower uncontrolled hyperthermia. Next, monitor laboratory and diagnostic studies, chest X-ray and here serum potassium, calcium, sputum culture, ACC. Here, rational for this to monitor the systematic effect. Next, number 18, administer transfusion, assist the plasmapheresis, hemoperfusion, dialysis. Here, rational for this may be done to achieve rapid depletion or extra thyroidal hormone pool in a desperately ill or comatose patient. Next, prepare for possible surgery. Here is reason for this subtotal thyroidectomy, removal of 5/6 of the gland may be the treatment of choice of hyperthyroidism once euthyroid state is achieved. Evaluation for this, maintained cardiac output. After providing these interventions, we write the evaluation for this diagnosis. तो ये था फर्स्ट डायग्नोसिस. नेक्स्ट देखते हैं सेकंड डायग्नोसिस हमारा फैटिग यार nursing assessment, nursing diagnosis, intervention, rational for this diagnosis. In first nursing assessment, subjective data here, patient verbalize that overwhelming lack of energy to maintain the usual routine, decrease performance, impaired ability to concentrate. Next, objective data for this here, jittery behavior, vital sign, emotional lability, irritability, नेक्स्ट डायग्नोसिस जो हमारा है नर्सिंग fatigue may be related to the hypermetabolic state with the altered body chemistry. This is the diagnosis for this nursing care plan. Next goal for this year to decrease fatigue and increase energy level. Next intervention and rationale for this intervention number first monitor vital sign noting pulse rate at rest and when active. A rationale for this year pulse is typically elevated and even at the rest tachycardia up to 160 beat per minute may be noted. Next no development of the tachypnea, dyspnea, pallor and cyanosis here. Rational for this auto demand and consumption are increased in the hypermetabolic state, potentiating the risk of hypoxia with activity. Next, number 3 intervention provide for a quiet environment, cool room, decrease sensory stimuli, soothing color, quiet music. Here, rational for this reduce stimuli that may aggravate. Agitation, hyperactivity, and insomnia. Next, number four, the intervention encourage patient to restrict activity and rest in the bed as much as possible. Here, rational for this help counteract effect of the increased metabolism. Number fifth, intervention here provide comfort, measure touch therapy or massage. Cool sober patient with the dyspnea will be most comfortable sitting in the high Fowler's position. Here, rational for this may decrease nervous energy promoting relaxation. Next, number six, intervention provide for diversional activity that are calming and reading radio television. A rational for this allow for the for use of nervous energy in a constructive manner and may reduce anxiety. Number seven, intervention avoid topics that irritate or upset patient. Discuss way to respond to these feelings. Here, rational for this increase irritability of the CNS may cause the patient to easily excited, agitated, and prone to emotional out- outburst. Next, number eight, intervention discuss with the significant other reasons for fatigue and emotional liability. Here, rational for this year, understanding that the behavior is physically based may be enhance coping with the current situation and encourage significant other to respond positively and provide support for the patient. Next, administer medications as indicated sedatives such as phenobarbital and anti-agent chlordiazepoxide here. Rational for this comeback nervous NAS and hyperactivity and insomnia. After providing these interventions, we write the evaluation here. The evaluation of this diagnosis here fatigue is decrease and increase energy level. नेक्स्ट देखते हैं नंबर नर्सिंग डायग्नोसिस थर्ड. दिस इज थर्ड नर्सिंग डायग्नोसिस here is for imbalance nutrition less than body requirement. यहाँ पर असेसमेंट देखते हैं. सब्जेक्टिव डर इंक्रीज एपिटाइट नोसिया मोर फ्रिक्वेंट बॉल मूवमेंट. ऑब्जेक्टिव डाटा nutritional status assess air diarrhea and vomiting also present. Next, nursing diagnosis for this patient here imbalance nutrition less than body requirement related to increased metabolism and nausea and vomiting. Here, goal is to improve nutritional status of the patient. Here, rational intervention and rational intervention number first monitor daily food intake, weight daily and report loss. Here, continued weight and loss in the face of the adequate caloric intake may indicate failure of the anti-thyroid therapy. Number second, encourage patient to eat and increase the number of meals and snacks. Here, give or suggest high calorie foods that are easily digested. Next, aid in the keeping caloric intake high and enough to keep up with the rapid expenditure of the calorie caused by the hypermetabolic state. Number third, intervention देखते हैं. Provide a balanced diet with 6 meal per day or rational for this to promote weight gain. Note if the patient has edema, such a low sodium diet. Next, number fourth intervention. Avoid food that increase peristalsis and fluid that cause diarrhea. Rational for this. Increased motility of the GI tract may result in diarrhea and impair absorption of the needed nutrient. Number fifth intervention here consult with the dietitian to provide a diet high in calorie, protein, carbohydrate, and vitamin. Here rational for this may need assistance to ensure adequate intake of nutrients. Identify appropriate supplement. Number six intervention administer medication as indicated. Glucose, vitamin B complex, insulin, small dose here. Rational for this given to meet energy requirement and prevent or correct hypoglycemia, insulin aid in controlling serum glucose if elevated. Here, after providing these interventions, we write evaluation. Now, your evaluation is improved normal nutrition status. तो ये हमारा थर्ड डायग्नोसिस नर्सिंग केयर प्लान कंप्लीट। नेक्स्ट देखते हैं फोर्थ डायग्नोसिस एंजाइटी नर्सिंग केयर प्लान। सबसे पहले नर्सिंग असेसमेंट सब्जेक्टिव क्लाइंट सेज दैट my attention span may be shortened, concentration reduced, and limiting the ability to assimilate information. Here, objective data. Here, noting palpitations, repetitive movement, hyperventilation, and shakiness. On the basis of these data, we write the nursing diagnosis. Here, the anxiety may be related to hypermetabolic state of central nervous system stimulation. Here, goal for this diagnosis. Your goal is to reduce anxiety. Next, intervention and the rational. Your intervention number first, observe behavior, indicate of the level of anxiety. Rational for this year, mild anxiety may be displayed by the irritability and insomnia. Next number second intervention, monitor physical responses. Here, rational for this, noting palpitation and repetitive movement, hyperventilation, insomnia. Next number third intervention, stay with the patient, maintaining calm manner, acknowledge fear and allow the patient's behavior to belonging the patient here. Rational for this to provide therapeutic environment. Number fourth intervention, describe and explain procedure, surroundings, environment or sounds that may be heard by the patient here. Rational for this provide accurate information which reduce distortion and confusion that can contribute to anxiety and or fear reaction. Number fifth intervention, speak in brief statement, use of simple word here. Rational for this attention span may be shortened and concentration reduced, limiting the ability to assimilate information. Number six, reduce external stimuli, place in a quiet room, provide soft soothing music, reduce bright lights, reduce the number of person having contact with the patient. Rational for this create a therapeutic environment. So the recognition that unit activity or personal may increase patient anxiety. Number seven intervention, discuss the patient and significant other reason for emotional lability and the psychotic reaction. Interventions rational. Understanding the behavior is physically based and acceptance of the situation and encourage different response and approaches. Number 8 intervention, reinforce the expectations that emotional control should return as drug therapy progress. Here interventions rational here provide information and reassure patient that the situation is temporarily will improve the treatment. Next, administer anti-agent and sedatives and monitor effect here. Rational for this may be used in the conjunction with the medication regimen and to reduce effect of hyperthyroid secretion. Number 10 here, refer to support systems as needed, counseling, social service, pastoral care here. Rational for this, ongoing therapy support may be desired or required by the patient, significant other if crisis precipitates lifestyle alteration here. After providing these interventions, we write the nursing evaluation of this care plan here. Here, reduce anxiety and client appear relaxed. तो ये था नंबर फोर्थ केयर प्लान। नेक्स्ट देखते हैं फिफ्थ और लास्ट केयर प्लान। ईयर डेफिशिएंट नॉलेज। ईयर सबसे पहले देखते हैं नर्सिंग असेसमेंट, एक्सप्रेस नीड फॉर द इंफॉर्मेशन अबाउट द डिजीज एंड इट्स मैनेजमेंट। नेक्स्ट ऑब्जेक्टिव डाटा, लुकिंग एनजीएस associated with the symptoms of the disease. On the basis of this assessment, rewrite the nursing diagnosis. Deficient knowledge may be related to information misinterpretations and the unfamiliarity with the information resource. Your goal for this to improve level of knowledge and your intervention and the rational. Your intervention number first, your review the disease process and future expectations. Rational for this provide knowledge base from which patient can make informed choice. Number second intervention here, provide information appropriate to individual situation here. Rational for this information induce the severity of the condition, cause, age, and concurrent complication to determine the course of the treatment. Next, identify stressors and discuss precipitators to the thyroid crisis, personal or social, and job concern, infection, pregnancy. Here, rational for this psychogenic factors are often of prime sorry prime importance in the occurrence and or expression of the disease. Next, fourth intervention, provide information about the signs and symptoms of thyroidism and hypothyroidism and the need for continued follow-up care. Here, rational for this, a patient who has been treated for hyperthyroidism need to be aware of the possible development of the hypothyroidism which can occur immediately after the treatment as long as 5 years later. Next, number fifth, monitor CBC periodically here to detect leukemia, thrombocytopenia, and granulocytosis if the patient is taking propylothyroxine and methimazole. Uh, Next, number six, intervention. Discuss drug therapy, including the need for adding to the regimen and expected therapeutic and side effect. Rational for this. Provide information about medical regimen. Next, number seven, intervention. Emphasize the importance of the plant respiratory air. Rational for this, prevents undue fatigue, reduce metabolic demand as euthyroid state is achieved stamina and activity level with increase. Number eight, intervention here. Review need for a nutritious diet and periodic review of the nutrient need. Tell patient to avoid caffeine, red yellow food dyes, artificial preservatives. Rational for this, provide adequate nutrients to support the hypermetabolic state. A hormonal imbalance is corrected. Number nine, intervention here, stress necessity of the continual medical follow-up care. A rational for this necessary for the monitoring the effectiveness of the therapy and prevention of potentially fatal complications. Uh, After providing these interventions, we write the evaluation for this diagnosis here. Patient's level of knowledge is improved. तो ये था हमारा फिफ्थ केयर प्लान. फ्रेंड्स एक बार फिर देखते हैं नर्सिंग केयर प्लान. फर्स्ट ईयर रिस्क फॉर डिक्रीज कार्डियक आउटपुट, यहाँ से आप नोट्स ले सकते हो. दिस इज सेकंड इंटरवेंशन, थर्ड, फोर्थ, फिफ्थ, सिक्स्थ, सेवन्थ, एट्थ, 9th, 10th, 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th, 19th, and ये फर्स्ट केयर प्लान कंप्लीट. नेक्स्ट सेकंड केयर प्लान, फटीग. Here first intervention, second intervention, third, fourth, fifth intervention, sixth intervention, seventh, eighth, ninth. और ये था सेकंड नर्सिंग केयर प्लान. नेक्स्ट थर्ड केयर प्लान देखते हैं, यहाँ से आप पिक्चर से नोट्स ले सकते हो. सेकंड इंटरवेंशन, थर्ड, फोर्थ, फिफ्थ, सिक्स्थ. Next, anxiety nursing care plan. Here first intervention, second, third, fourth, fifth, sixth, seventh, eighth, 9th, 10th. Next, number fifth care plan. Here first, second, third, fourth, fifth, sixth, seventh, 8th, 9, 10. फ्रेंड्स ये था आज का हमारा वीडियो नर्सिंग केयर प्लान हाइपरथायराइडिज्म, ग्रेव्स डिजीज और थायरोटॉक्सिकोसिस. आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा. एंड शेयर दिस वीडियो विद अवर फ्रेंड्स एंड सब्सक्राइब माय यूट्यूब चैनल ऑन नर्सिंग फाइल. जिन्होंने अब तक सब्सक्राइब नहीं किया प्लीज़ सब्सक्राइब माय यूट्यूब चैनल एंड प्रेस बेल आइकॉन ऑल्सो. थैंक यू.